The first question that comes to our mind when we are planning a hair transplant is, what are the side effects of the procedure? Hi friends, I'm Dr. Urvashi Chandra, and in this video today I'm going to discuss the side effects of hair transplant. So coming to the side effects, friends, let's first of all understand that there are different types of techniques available for a hair transplant. I'm sure you guys must have done your research. You people know that there are two types of procedures available. One is the FUE and the other is FUT. In the FUE procedure, which is follicular unit excision, grafts are taken one by one from the donor area and implanted into the area where there is a lot of hair thinning. Whereas in the FUT procedure, an entire strip of skin is cut from the back. It is further slivered into grafts. That defect is sutured. Those grafts are implanted into the recipient area. Now let's see the side effects of the FUT procedure, which is the strip procedure. In this procedure, what happens is that because there's a lot of cutting, there's suturing, the procedure is deeper in terms of cutting, which is why the downtime is more. Patients have to use a bandage on their head for a longer time. There is more pain. They have to stay indoors for a longer number of days. They cannot join work immediately after the procedure. Coming to the FUE procedure, that is something that is being done across many clinics in the world. FUT procedure is being done in very few clinics because patients don't choose the FUT procedure because of the downtime, the pain, the cutting, and I'm sure you would understand that if there is cutting involved, then the chances of nerves and blood vessels getting damaged is also more. So now more and more people have started choosing the FUE procedure. Again, in the FUE procedure, we need to understand that there are different types of techniques. The regular FUE procedure is typically done with a motorized dull punch. So a dull punch is used to extract grafts from the back. Because the punch is dull, that is why, and again, whatever I'm mentioning in this video today has always been proven through multiple studies across the world. I am a diplomate of the American Board of Hair Restoration Surgeons. That means I'm in touch with the hair transplant surgeons across the world. So according to these studies and the latest research that's happening, we now know that motorized blunt punches, motorized dull punches give you larger scars at the back, which is why a lot of patients that come to me after getting a hair transplant done from some other clinics which have used motorized dull punch, the first thing that they complain is that my donor area at the back is completely empty now. I have to keep long hair to keep it covered. Also, there is a lot of scarring, there are a lot of marks. Now, the procedure that we do at Chandra Clinic, we use manual sharp punch. That is something we import directly from Cole Instruments USA. Again, we have a lot of studies on this. Manual sharp punch is one of the best methods of extracting. It is very, very gentle. Manual sharp punches give you hardly any marks and scars at the back, which means if later on, let's say 5 years down the line, 10 years down the line, you feel you want to keep your scalp completely shaved off, you can do that. That is the huge advantage of manual sharp punch. So anytime you're planning to go for a transplant, make sure that instead of choosing motorized dull punches, you choose manual sharp punch. Again, motorized dull punch is beneficial for the clinic because it's faster. If I have to do 4,000 grafts, I will need 2 days for it. Because manual sharp punch is a slower process. A motorized dull punch is a faster process. Clinics are able to do 3,500 to 4,000 in a single day. So obviously, it is a faster process for the clinic. The clinic saves time, the surgeon's time, which is why it is cheaper as well. Because obviously, instead of giving 2 days to the procedure, the team has only given 1 day. However, it is not beneficial for you because you are getting more marks. Now coming to the implantation process. Even in the implantation, there are two types of procedures that are available. Number one procedure is which is the regular FUE. Reception holes are made in the implanted, the bald area, and one by one the grafts are held with a forceps and pushed into this reception hole. Because of this pushing, there is a lot of graft damage. Graft survival rate is not 100%. So suppose we have put in 4,000 grafts, it is possible that only 3,000 or 3,500 will grow back. Whereas in the technique that we use, implanter pen, the growth is 100%. Now why I am telling you all these is because according to the technology that is being used in the hair transplant process, according to the instruments that are being used in the hair transplant process, you will either get more side effects or you will not get any side effects. With the implanter pen technique, the huge advantage is that your result is 100% natural, number one. because it's like a pen type of instrument. Okay, so we are able to exactly monitor the angle and direction at which the hair is being put in, because our natural hair is never perpendicular to the skin, it is always flat on the skin. So we have to simulate exactly the same angle and direction, only then you will be able to get your natural result. And that is one mistake many clinics make, that their angles are not correct. So when you see their results, they look very, very unnatural, and any person looking at you is able to say that, oh, you got a transplant done. So that is embarrassing, right? We don't want people to know that we got a transplant done. We just want them to know that yes, we have hair, we have good hair. That is it. So that is the number one advantage of an implanter pen. So again, in the regular FUE, this is a side effect that you have, that your hairline does not look natural. You have hair, but it doesn't look natural enough. It looks like doll's hair. It looks pluggy. It looks hard, and you can just comb your hair back. You cannot comb your hair sideways. You cannot style your hair the way you want to. Now the second thing is, with the implanter pen, you have 100% graft survival. So if 4,000 grafts are being put in, 4,000 will grow back. So again, that is a disadvantage, or let's say a side effect of the regular FUE procedure, that the graft survival rate is low. 4,000 grafts being put in, but what is growing back is 3,000, 3,500. So the density is obviously not up to the mark. But with the implanter pen, because the angles are correct, the graft survival is very good, density is perfect. You get the kind of density and the look that you want. Now, these are the two techniques of FUE. Like I said, the regular FUE can give you marks at the back. It can give you, skin elevations, little zits that we call cobblestoning. So if you will see regular FUE follow-ups, you will see that, or any person in your known who has got regular FUE done with the reception hole technique, you will see that the skin is not smooth there. With the implanter pen, again, the skin is very smooth, so we are completely avoiding that side effect. Now, there are other minor side effects that can be possible with any hair transplant technique, whether it is FUE or the procedure that we do bio-IPT, implanter pen technique, or with the FUT. These minor side effects are like, you can get some zits, you can get pimples or boils in the implanted area or the donor area, but again, these are very easily manageable. If we give you a short course of antibiotics or some other medicines, they will settle down. The other side effect that you can have is swelling. Again, that is normal. 10-20% people after a hair transplant do get some swelling on the forehead, and it's very, again, simple to solve that. You just have to massage your forehead from the center to the side, or you can use some ice packs. So because of the ice, what happens is that the arteries constrict, and when they constrict, they actually push the fluid out of this area. The arteries work like a pump. The other side effect that is possible is itching. Again, for that, I prescribe my patients some kind of anti-allergic medicines like levocetirizine, so the itching is under control. I advise my patients to apply coconut oil on the implanted area, even on the donor area. That way, the entire skin is kept very smooth and soft and supple, and they don't even have any marks after the procedure. And the other side effect that's also possible is some amount of pain. Again, like I said, these are very minor side effects. Hair transplant, fortunately, is a very safe procedure if done in safe, in good hands, in a clinic that maintains all its hygiene and sterilization. If done in such a clinic and by a qualified doctor and not by technicians, that this is something that's very important. If a qualified and experienced doctor is doing your surgery under very, very sterilized and hygienic conditions, the percentage of side effect is very, very minimal. You really don't have to worry about that. To cut short, to kind of brief up the entire video, basically we need to make sure that we choose the right technique of hair transplant. We should be choosing implanter pens, again, because for the purpose of cost cutting, many clinics don't use the best instruments, they don't use the best technology, only to cut down the cost. However, in our clinic, we believe that we should be doing the best thing, using the best technology, using the best instruments. The surgeon only, which is I operate on my patients, my team assists me, but again, it's not that I will leave my patient to the technician and they are doing the entire process. That never happens. So if you choose a good clinic, a good surgeon, good technology, good instruments, and clean, hygienic, sterilized OT and environment, then the possibility of side effects is very, very minimal. So I hope my video helps, friends, and all the best. Bye bye.